You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. He is Virginia's go-to implant dentist, Dr. Jamie LaViola. Dr. LaViola, welcome to the program. Welcome back, I should say.
Thank you. It's a pleasure to be back here.
Now, you were doing implants. I remember I had you on the program, close to 8 years ago.
Yes.
Right? So what's changed? Because we were talking on the phone. You said everything has changed. So what's changed?
Quite a bit has changed. So first, the technology piece. There's so much technology that has evolved since we last met. We have scanning, facial scanning, in-house labs, printing. So that's really changed the workflow and how fast and predictable we can help patients.
In fact, you told me what used to take you like a year, or even most practices today, a year, you're able to do in like 2 days, 3 days.
Essentially, yeah. We can get from start to finish for the entire process in as little as 3, maybe 4 visits.
Okay, good.
Including your intake records when you come in and get all the information. So one of the real things that has changed is basically my appreciation for the patients and what they go through and how they transform. So
it's life-changing, you say, for these people.
It's life-changing.
I always think you're exaggerating when you tell me this.
No way.
But it's that big for people.
It's that big. You have to consider that people either have no teeth or they're on the way to having no teeth and they're not smiling, they're not being able to eat properly, and it just transforms their lives. So the more of this that I've done in my journey and the more that we moved along with the digital workflow, I just have such an appreciation for how it affects people's lives and transforms their lives.
Now, correct me if I'm wrong. And the way dental implants are typically done, and I want to make sure we're not exaggerating about anything here, but you go to one doctor that does the surgery, the implant surgery, another doctor that puts the teeth on top, and then another doctor that even maintains those teeth. In your office, you do all 3 parts. Is that why you do it so quickly?
That's definitely a factor. So that model of being able to do all parts, and then on top of that with the in-house lab that we're investing in, that we continue to invest in, that makes it even faster.
Yeah, now you're printing teeth like in the next room. Not an exaggeration at all?
Not an exaggeration.
So it's like all done on a computer? Like when you call it digital workflow, you're talking about designing everything on a computer based on their anatomy.
Exactly. So essentially we're going to scan your face, we're going to scan your teeth, put all these things together. It goes for a CAD/CAM design on a computer.
Okay.
And then once that design is approved, I like it, we press the button, goes over to the printer, teeth get printed. And when we're doing our final ones that are zirconia, the best material, same thing, but it's a mill.
And now they look better and more real than ever before today.
Absolutely.
Is that correct?
Yeah, they look amazing.
How old can you be to do this? Like what's your oldest patient?
So how old, there's not really an age limit.
Okay.
The oldest patient that I've had in my practice was 91. She had a full upper set of teeth supported by implants.
Now why would a 91-year-old want to do this?
It's a great question.
Okay.
If you're 91, one of the most common things you're going to be doing is enjoying family time with your grandchildren, going out to eat.
Okay.
And if you don't have teeth to eat properly, or maybe your grandchild says, "Grandma, why does the denture? Why your teeth come out?" It's for that.
You heard that from patients?
I have. So it's so that person can enjoy their meals, enjoy the times with their family, whether it's home cooked, going out to dinner. It makes a big difference.
91 is not too old. They're not more likely statistically to fall out at 91?
No, not at all. And that's why when someone's 65, 70, they come into my office, I'm like, no problem.
Do they think they're too old? Like a 65-year-old says, "Doctor, am I too old for this?"
All the time. And, to be truly transparent, these people, when they do get it done, the only regret that they have is, why didn't I get it done sooner? But they are enjoying that ability to eat, smile, and be social,
okay.
And do some of the things that they have been missing out for the past 20, 30 years.
Do they still say, "Hey, no offense, doctor, but I don't like the dentist"? Do you ever hear something like that?
Oh, all the time.
Do you have a comeback after all these years of hearing it?
No, I just say, no, that's cool. I don't like sitting at the dentist either.
Now, do you have a secret goal to kind of win them over time?
No, not a secret goal. I just try to get to know who the person is.
Okay.
Where they are now, where they want to be, what their goal is, and maybe why. And then from there, just try to provide a solution for them.
Okay, good. And so things are done very quickly today. And you were saying, I mean, we were having a discussion and people need to know, I'm trying not to endorse you here, but I think you said, I mean, like 1% of the dentists that are doing dental implants are doing it this way, where they're making the teeth right there in-house, where they do both parts of the procedure. Is that fair to say?
That's fair to say. And I know the old way, by the way, because I used to do the old way where we would do everything by hand. We would have to make the teeth the day of surgery. And so this process it's so much better. It's so much better. The results come out better, more predictable. They look better. It's faster. That's why I get so excited about it, because the amount of change that has taken place with this workflow, everyone is going to be doing it in the future. If not, I don't foresee you being in that field.
So dentistry, do you think this is the future? Like, let's say 20 years from now, 40 years from now, dentures as we know them today will be eliminated. They'll all be attached to something like implants?
I sure hope so, because the potential is there. The potential is there, definitely.
Is it? I mean, in Virginia, we think of it as a healthy place. Are there that many people wearing a denture or headed to a denture?
There is. There's
like tens of thousands?
I would say tens of thousands, definitely. There's people that wear dentures. I see in my practice maybe more people that are really headed towards dentures, which, when we go through some of our pictures, we'll take a look at that. But either way, if you're in a denture, you're going to a denture, you're going to a place that you don't want to be.
Now, what about if you have bad gums? Can you get dental implants with bad gums, like a gum infection or gum disease?
Those are some of the people that we get all the time.
Okay.
Yeah, we get people with gum infections, broken teeth, cavities, infected teeth, bad teeth, you name it.
So you clear up the infection, gums get healthy.
Correct. We clear up the infection, get rid of the bad teeth, get everything ready to put the implants in, and and then we put the teeth in.
Okay, good. Now you brought some photos. You brought a stack of photos. So we're going to try to get to as many of those as we can. What are we looking at over there?
Okay, so that's Emily.
Okay.
So as you can see, when Emily came to us, she was very self-conscious about her smile. In fact, she wasn't smiling much. I had to force that. Some people can't make that smile, by the way, on cue with the camera. Teeth are broken and major infection. She didn't have a whole lot of gum disease like we talked about, but broken teeth, infection, and really wasn't able to eat and really wasn't able to smile. I think at that point...
Like eat what? Like what's tough when you have bad teeth to eat? What do they complain about? Like salads
meat,
or...
apples, salads, raw vegetables, some of the things that are really healthy. You name it. There's so many different foods that people can't eat. So when she comes in, she says to me what's common, "Doc, you haven't seen anything this bad." I get that all the time.
Okay.
And she doesn't really know what can be done. One of her options could have been a denture, but that's why she came to us, because she did not want a denture and was looking for other types of options. So as she came through the process, we looked at everything, did our due diligence, took our records, our whole digital workflow. In fact, this might have been slightly before that, but we still were on the way to digital, got the information, and we ended up giving her a full set of upper and lower teeth secured by implants.
That don't come out.
They don't come out. And in fact, I just saw her. She's 4 or 5 years. She came back for her cleaning. She's doing phenomenal.
Let's take a look at the after.
Take a look at that.
That's very nice. She looks happy, for sure.
Yeah. So as you can see, it's something where she may even have to relearn to smile, because some of these people don't know how to smile. Teeth look phenomenal, and it's really been a life changer for her.
So once it's done, they come to the dentist, get cleanings just like regular teeth. Is that correct? I mean, obviously with some modifications.
Yes, that's correct. We give them a little bit of instruction. They come in, we get them cleaned, and then at home they have their routine to clean them as well.
Now the bad breath and things like that goes away?
That does go away, unless you're not brushing your teeth like you would your normal teeth.
Okay.
But yeah, it goes away.
Now, when somebody like this, especially with really bad teeth before, what's it like when they look at the mirror, in the mirror for the first time?
It can be incredible. I've had people cry. I've had people look at them for 15 minutes and just say, "Wow," and feel them.
Is that right?
Yeah. That's why I do what I do, to see that reaction of when those teeth first go in. So all kinds of reactions.
So today, because you're doing it, I guess, in a more minimally invasive fashion, is it less downtime than it was like 8 years ago in your hands?
The downtime from that standpoint is more managing medications, managing your patient, basically knowing what to expect before they start and preparing for it before they start to get ahead of the pain.
Okay.
So we've been doing that for a long time, so that the technology piece and all that really doesn't affect that. It's really the same. There's very little discomfort.
Is that right? Like they don't complain about pain all the time?
No, there's a couple people that have different pain thresholds,
Okay.
right? But for the vast majority of people really have very little pain, very little swelling. In fact, we'll show you a case there in a bit. But yeah, there's very little.
So they're numbed up, obviously, and you're giving them sedation. I think you told me they have very little memory of the whole situation.
Correct.
Is that right? They just get a ride home?
Yeah, so we'll have them they have to have someone drive them to the appointment if they're going to be sedated. By the way, I have had a couple people do this without sedation.
Is that right?
I don't know if I would sit in the chair and do it, just because, as a patient. But having said that, they have their driver bring them to the appointment, take them home. We tell people not to make any purchasing decisions or anything like that when they're sedated.
Okay.
But and then when they become alert and they see what their teeth look like, that's where that transformation takes place. So, and on top of that, to answer your question about the discomfort after the procedure, there's very little because we've given them instructions, icing, medications, and so on.
So the two main categories are people that still have teeth, but they're bad. And it's been determined all their teeth have to be removed. And then, of course, the denture wearers. Let me ask you, so if you've been wearing a denture 10, 15 years, you can't do this because you don't have enough bone?
No, not true.
Okay.
So you can most definitely do it. And that's where taking a look at a 3D scan of your bone, we have special implants that we can use if there's inadequate bone, instead of having to do long bone grafting procedures in the past that would take 9 months. So we can still do this and have you done.
So those days are over, like all the bone grafting, a lot of bone grafting.
99%.
Is that right?
Yeah, because of these different styles and technology with the implants. And obviously you have to get training to use these implants. But yeah.
And most of what you like to do, and I don't want to put words in your mouth, but there's a snap-in, snap-out type of dentures, and then there's teeth that don't come out. You're not a big fan of the snap-in, snap-outs, even though you do them. Tell me why.
So I do them because it's a nice segue to the teeth that don't come in, don't come out.
Okay.
Here's the thing: if you're taking the teeth in and out, it's you still have to, there's more maintenance to it. There's parts that you have to change out. And not everybody wants to take their teeth out.
So it's still a denture?
It's still a denture, yeah. I mean, it's a great solution as a transition to the teeth that don't come out, or someone that maybe has been wearing a denture and hasn't quite gone all the way for the teeth that come in and out. But it's not my favorite. I would prefer to keep everyone in teeth that don't come in.
It's just a happier group of patients that get teeth that don't come out?
Correct.
Is that fair to say?
It most definitely. But what I will tell you that's different about how we do our dentures that lock in or snap in is I'm planning these cases to be upgraded. So one of the things that I see, and a lot of people start this way in dentistry, is they'll do snap-in dentures because they can be easier just to kind of put the implants in and make the denture. But then what happens is if someone wants to upgrade the teeth that don't come out, and the implants are not in the right spot, it's a disaster. So when I plan these cases out, I'm making sure the implants are in a spot where you can upgrade
to teeth that don't come out.
To teeth that don't come out.
Very nice.
So that the plan is the same whether they, snap in, snap out, or they don't come out. We're still putting them in the same place and putting the implants in the right place.
Okay, good. You have more photos. What are we looking at?
Yeah. So that's Kev.
Okay.
Yeah, so with him, as you can see, there's very few teeth. The ones that are there are loose. There's infection, there's gum infection, there's cavities. The teeth are on the way out.
Okay. So what'd you do?
We gave him upper and lower teeth on implants. And
Very
as you can see, it's a phenomenal result. For him, the main reason that he did this was being able to chew. So when he got to the point where he had his final result, he's chewing everything.
What do you say?
He's like, kept doing that, showing me how she's like, look at my choppers. Yeah, he was so happy after he was able to eat food.
Now, a lot of people, we talked about this again in the green room, that it's frustrating because, even the best dental insurance doesn't cover this. Medicare does not cover this. Medicaid doesn't really cover this. But you say people are financing it. I mean, if you have okay credit, you have lenders that work with people.
Yes.
Yeah, is that right? Is that common or not so common?
I think it's common for us. We have 3 or 4, I think maybe 5 now, different companies that we work with that are lenders. And what's cool about them is they can get you a lower payment to be able to get through this process. So maybe if you want the teeth that stay in, but what's in your bank account, you need to be able to make payments. We have that option.
Okay, good.
So it's great. It's obviously, interest rates are what they are, but the process has been great to help people. Let me show you this next picture.
All right.
So that's Jane. She came to us with all sorts of problems: missing tooth, bad gums, infection, teeth that had cavities, and really had no idea what her options are. In fact, she wanted to start with a partial, so we gave that to her. Didn't work. She said, is there anything else we can do? I said, yes. So we gave her full upper and lower teeth supported on implants. And she went from what she did at the current time, I don't remember, but now she's a full real estate broker. In fact, she just helped me get my new house.
Oh, that's nice.
Yeah, so phenomenal result, great person. And
I mean, does she smile more now that you know her?
oh yeah, like just being able to walk houses and properties, I could see it there, where when she came in, there was no smile. In fact, in the before, you can see it's hard to even get a smile out of her.
Very nice.
Yeah. So here's another one, and this one came in and said that you'd never see anything like this, doc. And she did have very bad situations. She's from another country, I think France. Just took a long time and never really had proper dental care until the teeth were so loose. And she told me, I will not accept a denture under any circumstances.
Okay.
So it's one of my earlier cases too. So we went through, did the record, saw that we had enough bone to work with and found spots to put the implants in, gave her full upper and lower implant supported teeth.
Let's take a look.
And I still see her. I think we're 6 years out. She comes in for her cleanings, regular basis. It's come in, clean the teeth. Hey, doc, how you doing?
And she can eat whatever she wants.
Anything.
Are they limited? Like, be careful with steak, or be careful with like a raw carrot?
No, I would say be careful with a rock.
Okay.
Don't chew ice. Anything that would break your natural teeth, I would still try to avoid. I've got somebody in here that chews ice, but
You can't talk them out of it.
not supposed to talk. Yeah.
Now, if you're over 70, statistically, you're on 3 or 4 medications. The patients you get, are they on medications? Are they on like type 2 diabetes medications? Can you be on these things? Maybe even a blood thinner or osteoporosis meds? Can they still do it?
Yeah, so there's medications. Now, that's one thing that's important about when you're getting implants done, is it's important to look through the medical history and see what's there and what's relevant. If you're on a medication for diabetes, we need to know what your blood sugar is and make sure it's stable.
So if it's controlled, pretty much they can do it.
Absolutely.
Very nice.
And that, we help people get to that point too, because they want it so bad. So, all right, that's Willie. So Willie is actually wearing a upper and lower denture, and I know we're on no more dentures, but we are going to put this gentleman in fixed upper and lower implant supported teeth that don't come out, and that's his plan. This is his starting point.
So you make like a cosmetic looking denture if need be.
Correct.
Like an affordable situation.
This was actually made the same way using our digital process, so it's milled out.
So you design everything there on site.
Yep, it's designed, it's milled, and he goes home with that. So
looks good.
Yeah, and the cool thing is that he's going to do the next step, which will put the 4 implants on the bottom, and then we'll put the 4 implants on the top, and it may take a bit, but he's determined.
So it only takes like 4 implants, you get a full arch of teeth, a full set of teeth on those.
Correct. So
is that right?
4 is the minimum. They call it all on 4.
Okay.
Some people call it all on X. Our what we call is one-shot smile.
You call it one-shot smile. What does that mean to you?
So I'm a big basketball fan, as you know, and played basketball,
Yeah.
love basketball. So I just, when I thought about the idea that we could get this done really in one shot or one day, so we came up with one-shot smile.
So somebody watching this, bleeding gums, bad breath, loose teeth, or they're wearing a denture. I mean, of course, you'd have to have an opening in your schedule. If everything worked out right, they could have their teeth like the day after tomorrow. Is that true?
That's true.
Interesting.
That's true. Yeah,
Does that
absolutely.
ever happen?
It has happened, yeah. So
Okay.
it's not the norm. Usually there's a week and we gotta,
Yeah.
But yeah, absolutely. So this is Eric.
Okay.
Eric came in, typical loose teeth, bad teeth, infected teeth. And take a look at the after. Look at the difference there. You can tell that it's drastically changed how he looks, how he feels about himself.
On the before, was that guy going to end up in a denture? Like if he went to the wrong place, I shouldn't call it the wrong place, but
Yeah.
could he have been offered just a denture? Pull out all your teeth, give him a denture?
He could have totally been offered that, or he could have been offered the dental treadmill. Let's clean your teeth, clean them, and then 7-8 years later, he's still in a denture.
Okay.
Yeah.
So those are upper and lower teeth that don't come out.
Those are upper and lower teeth that don't come out.
Look good. Look good.
Yeah. So I got to show you this guy here. This is Brian. He's one of my favorite patients. They're all my favorite patients.
Okay.
He was referred from the gentleman you saw before, Eric, and he came in with teeth that were broken. Not really gum and bone problems, but just broken teeth, infected teeth, worn teeth, you name it, and didn't really know what his options are. But he did not want something that comes out of his mouth, in and out of his mouth. He wanted teeth that stay in.
Okay.
So, we did our process. This was actually a full digital where we took the facial scan, got through, and what you're seeing here is 3 days after surgery.
Wow.
So as you can see, I mean, would you say he looks more educated or sophisticated?
He does. We
unfortunately-
talked about this.
Yeah.
I always think it's just teeth, but it's more than that.
It
He's
is.
more handsome too.
Absolutely. And it's one of these things that unfortunately is a stereotype, but it's true. So, bad teeth does not mean that's who you are, but that's
People judge you. Do they feel judged? Did they ever tell you that?
I think they do, and people have actually told me that, or they tell me they don't smile. They've been hiding it for a long time because of the teeth that they have.
So the way it works, your system. Okay, so they come in, you meet them to determine whether they're a candidate. Step 2, if they decide they're going to move forward with it, take the measurements, do the scanning.
Yep.
Step 3, they get their new teeth. And
Correct.
that's the way you did it with this guy.
That's correct.
And you print their initial teeth in office.
That's correct.
Very nice.
So, and again, you can see 3 days. We talked about post-operative pain, swelling, very little.
Very nice.
He's been following his thing, taking it easy for now, but when he gets to final, he'll be chomping whatever he wants.
When you ever, you told me this, that sometimes you're on a consult, you're hearing their hard luck story and you're getting excited.
Yeah.
Because they don't know how good it's going to be.
Yeah.
Can you elaborate on that?
Well, yeah. I mean, if you look at this picture of Brian, like he has no idea what he can look like.
Do you see that end result?
I do.
Do you see like, man, this is going to be good?
I do, especially for somebody like that, because I can see like he shows too much gum or whatever it is. I can see what the issue is cosmetically, so I know where we're going to go with the final product. And of course, then we put it as plan in, and I can see, do I like it? Can I make changes? So yeah, you can see me getting excited right now.
Now we're short on time, probably 3 or 4 minutes left, so I'm going to rush you because I know you still have a bunch of photos to show.
I do. So here's Natalie. She came to us. She has cerebral palsy. Some of her challenges, besides the missing teeth, were inability to eat. Swallowing food can be difficult with that specific disorder.
So she couldn't really chew with those teeth.
No. So it becomes more difficult to swallow. Speech as well, it was harder because there's speech issues to begin with. And she went to 4 or 5 dentists before she found us because she said no one was willing to treat her. We did have our anesthesiologist help her, and we got her treated, and you can see it looks phenomenal.
Looks nice.
Yeah, she's going to be doing the lower pretty soon as well.
She looks pretty happy there, by the way.
Super happy. So she's been kind of one of our, she's like our family member. So this is actually this is the aunt of one of my assistants, and as you can see, there's the mask. This was during the pandemic, so she was missing teeth in the back.
Okay.
And so you can't chew without teeth in the back. It's very difficult. And for her front teeth started to wear down. They started to move, shift. And we were able to fix the front teeth, save teeth using crowns, a couple veneers, and in the back place the implants so that she could chew again and save some teeth. So she didn't have to get a whole mouth of implants, teeth, some
She's looking pretty good there.
Yeah, it's a phenomenal result. So I was just...
And one of your employees, that's the aunt.
Yeah, absolutely. So it was just a joy for me to work with her. So this is a husband-wife, and she wasn't thrilled with her smile. As you can see, the teeth are kind of like misshapen. And look at the final result. We did some routine dentistry and really just remade her entire smile. And it's been a joy. She still looks this way 7-8 years later. But here's her husband.
Okay.
So she referred to her husband. Husband was missing. He had, I think, one tooth up
Is
top.
that him smiling?
That's him smiling. He doesn't know how to smile, as you can see. And you don't know how to smile like that. So partial up top, missing teeth on the bottom, came to us on an emergency. And he said, Doc, what can you do? He didn't know what the answer was. We could put him in upper and lower, fixed teeth on implants. And it's been a joy. Now,
So when you say fixed teeth, that means teeth that don't come in and out.
Teeth that don't come in and out. He can chew whatever he wants now. You can see his
that's
smile
a big difference.
Drastically different. He doesn't show a lot of teeth because of some men don't show as much sometimes, but huge difference.
You think after a few compliments out on the street that he'll start smiling bigger over time? Is that what
absolutely.
happens?
In fact, he has, because I've seen him, about 5-6 years as well. So different person. And here's John. So John had been to our office multiple times, has had a couple sedations because he's high fear, and the front teeth that you see there maybe don't look that bad, but there's cavities all around him. He's missing a couple teeth in the back. Finally, he lost one tooth, and I said that's the final draw. So we ended up, for him, giving him full upper and lower teeth that are supported by implants, and it's made a dramatic difference in his life.
Looks good.
Yeah, he looks great. He went back to school. He talked to me about dating and things that were not something that we talked about before. And it's just, for him, for John, I was just so happy, and it was just a pleasure to work with him.
And they all have the same regret. I like what you say, that they should have done it earlier.
Absolutely. Always, they're thinking about the time they lost with what they have now.
Okay, now we're out of time. So final message, the two groups of patients, they're wearing a denture or they have teeth that are really, really bad, and they're going to end up in a denture. Let's say that they've heard what you have to say, but they're still skeptical or afraid. What do you say to them?
Come on in, get to meet myself, meet our team,
okay,
and see that it's not as scary as you think it is, and we're going to be able to help you.
Okay, good. I want to thank you for coming on the show. Always a pleasure. If they want to make an appointment, do you prefer to go to the website to make the appointment or just call your office?
Either way, we've got you can go on the website and fill that out, or you can call our office. Either way is fine.
Do they get to see you on the on every consult?
Yes, every consult they're going to see me.
Okay. Dr. LaViola, pleasure to have you on the program.
Thank
Thanks.
you.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.